Right, decided to do a quick video and my phone's starting to discharge. I think I've got about 10% left, so this is going to be quick. Okay, so just decided to do a quick video on dermal fillers. I've entitled it What, Who, Why, Where. So the what of dermal fillers is dermal fillers are a gel-like substance that get injected into the skin to improve fine lines, wrinkles and to add volumes to such areas like cheeks, chin, jaws, temples as well that can be injected. Problems with dermal fillers, they can cause necrosis of the skin if an artery or blood vessel gets blocked. It can also cause blindness and strokes. I must say though that the risks are low, and I try to make those risks even lower with me, if you come to me, by following certain rules that I've got. I will always, when I'm injecting, I will always aspirate. So I've just got a little syringe here. So what I mean by it is just pulling back on the syringe. So if I get any blood in the tip of the needle, I know I'm probably somewhere where I don't want to be. So I'm not injecting actually into the blood vessels. What else do I do? Oh, I use cannula quite a bit as well, especially if doing tear trough area. I'll use a cannula because cannulas are blunt, they're a plastic needle, let's say, and it will bounce off structures as it gets into the skin. So there's less chance of penetrating a blood vessel and getting actually filler in there and causing these problems that we don't want. Also got hyalase on hand in my emergency kit, so if I do need to dissolve the filler, it's there right away. Who has filler? So I inject people from the age of 25 up to 75. Young people normally have filler for beautification, for enhancement, such as enhancing the cheek area, enhancing the lip area, enhancing the jaw, making a nice square jaw, chin as well. So more enhancement, whereas more mature people will have it for anti-aging purposes. So with the anti-aging process, we lose bone, fat, skin becomes saggy, we lose collagen in there. And what we can do is to use filler to aim to replace, such as fat pads that have dropped. You have medial fat pads here that will drop and make the nasolabial fold here deeper. Okay, so we can pop a little bit of filler in there, brings it up, and you get more of a natural, I can't do it on myself, more of a natural look after replacing that fat pad. And we can, in women especially, they love to have the filler put across there, just brings that cheek out a little bit. That's a nice one. So younger, enhance, mature, more anti-aging, and we can do it in a lot of places: cheeks, lips, jaws. And it's not unusual for a more mature lady, or man even, to have multiple syringes put in. So anything up to 11, 12 syringes can be put in at one time. When you think about, you can have 2 syringes for cheeks, you can have 2 syringes for the jaws, another one for the chin. We can do them the jowl area here, another one there. We can fill out marionettes, nasolabial, lips, temples, So as I say, multiple syringes, not uncommon, and the results can be really nice. In fact, I'll just show you the photo for some training I did. Okay, this is from the handout. It says Skin Viva that I trained with. I do need to say that because it is their photo. So this lady's had multiple syringes. She's had jaw area, that's the before, there's the after jaw area, and you can see the actual difference in the marionette fold there. Can hardly see it on that one. She's had, I think she had some in her nose as well. She's had a tear trough area, which is underneath the eyes. I think she had some in her temple as well. Yeah, I was told that she did have other treatments as well as filler. I think she had lips done as well, yeah. But mostly it was dermal filler that she had. So nice for anti-aging. Men, do men as well. Nice one for men is the jaw here. Can make it more masculine jaw. You know, a masculine jaw is nice and square. We can make it nice and square. And the chin as well in men. We can make that nice and square. As women, it does tend to be, well, it is thinner to bring back that youthful triangle. Okay, so when we're young, our face tends to be like that, so triangle like that, so more at the top, less at the bottom. As we get older, it all flops down, so we tend to have more at the bottom, less at the top, and that's what we're trying to do with the anti-aging treatments, is to bring back that youthful triangle. So just very quickly before my phone runs out, why have fillers? So when somebody comes to me, first of all, when they're having fillers, I like to know that they're having it for themselves, to build the confidence, to feel better about themselves. It's not about looking good for someone, you're having it for somebody else. Like big alarm bells ringing me when I have ladies in saying, oh, my husband said I'm looking old now, he's going get a younger model and things like that. You know, they might have been joking, but I just feel, come on, yeah, you want it for yourself. I want you to feel better about you. I want to build your confidence up. That's what I like to do it for, and that's why you should be having it done, really. Where to go for filler? So me, obviously, I will say that, but if you're watching this video and you're somewhere up Glasgow, down south somewhere, you can't get to me, you need to go somewhere and have a practitioner who is medically trained. So what I mean by that is a doctor, a nurse, a dentist, oh, my throat's getting dry now, pharmacist, prescribing pharmacist, and you can check out their details online. With myself, it's NMC, so Nursing and Midwifery Council. You can search for me online to make sure I am who I say I am. I am a prescribing nurse. And you can also do that with doctors, dentists, pharmacists. Also, just making sure that you feel happy with the person who's injecting your face. So you can ask them how long have they been doing it, how many treatments have they done. You can do your research on them, look for before and after photos. I tend not to put a lot of before and after photos on Facebook, Instagram, things like that, because I need to make sure that those before and afters, they're not photoshopped. They, the patient that I've injected, I've got their full consent, they're fully aware that that photo could then go, oh well, on the internet, could go anywhere really. So yeah, so you can check for before and afters. I do have a portfolio of before and afters in clinic that people can look at as well. So just making sure that your practitioner is ethical as well, that they're following proper prescribing rules, advertising rules as well, that they're going to tell you everything which is a problem because you don't know what you don't know. But you've just that you feel safe with them and happy for them to actually inject your face. Any questions, obviously, just get in touch and I will try and answer as soon as I can.